Even if she was, at a 5-year-old level that talks a lot, that's great. I'll take that forever. So we'll take any level as long as she can communicate. Because right now she can't tell us what hurts or what she needs or, how things feel.
In a world filled with uncertainty and risk, we want to do everything we can to protect our children. In that respect, Lori Hops is no different than any other mom. But Lori's hopes and dreams for her 8-year-old daughter, Brianna, are different from those of most parents.
I just want her to be able to, tell us what she needs or wants. Because I know, she'll live with me forever, of course. I'll always take care of her. But I just want her to be able to talk. That's my main goal for her. Pretty much just my only goal. Just as long as she can talk. Everything else is okay.
Brianna, or Weeble as family and friends know her, is full of curiosity and mischievous energy. But her life has also been filled with challenges.
She's having seizures, by the way, right now. So you're fixing to see a bunch of these. These are the head drops I was telling you about. We've got to get some kind of control, better control on them than what we have.
Brianna was born a beautiful, healthy baby girl in Central Florida in 2002. But just before her first birthday, she became sick.
She had a fever, and she had a runny nose, and then she started the vomiting, and she just slept a lot. She was real tired, so it did just look like a cold, the flu or something. And then it wasn't till she wouldn't wake up, and she couldn't hold her head up, and she wouldn't sit up. That's when we knew something was wrong. But by then it was too late. They did 2 spinal taps, and then they had to do the 3rd one in Orlando. They took her up there emergency, and they found out it was meningitis.
Weeble had contracted strep B pneumococcal meningitis, a disease that causes inflammation of the membranes that protect the spinal cord and brain. It's a disease that kills roughly 20% of its victims. Weeble suffered a stroke, which left her brain damaged.
She was having seizures literally non-stop. They had to put her in a medically induced coma because she was just seizing and seizing over and over again. They said she wouldn't make it through the night. She wasn't going to make it through the night. And the guy said it 7 times. We don't think she's going to make it through the night. I don't think I really thought she would make it, so our great-grandma was planning her funeral, but I wasn't. I didn't really think they were serious. It was on my birthday, the 23rd of May, is when she kind of you could tell she was getting better. Everything started, her levels started going normal. So that's when I knew she'd be okay. They told me how what it had done to her spine and her right side weakness from the stroke, but they didn't really explain when they sent her home with me what it was going to be like. So it was kind of like being sent home with a newborn. She's now has the mind of a 2-3-year-old, and it's slowly, and she's been about a 2-year-old since that day. So in 8 years, it hasn't really changed much. So she's forever, a baby, pretty much.
Lori, Weeble, and their family and friends deal with every challenge and have hopes for a better future. But for Lori, there is a heartache in knowing that a vaccine could have prevented the pneumococcal meningitis that changed her daughter's life.
I was for vaccines. I didn't know what vaccines. I just, whatever they said she needed, I was, willing for her to have. My doctor did not tell us about the pneumococcal meningitis vaccine.
The pneumococcal vaccine is just one of the vaccines that have been developed in the past couple of decades that have helped keep infants and young children safe from disease.
What's extraordinary now is if I'm at home and I get a call from a family and it's midnight and the child has fever and parents are worried, my first question is, has your child been vaccinated? And if they've had their vaccines already, I can say, you know what, this is a virus. I'll see you in the morning. If it's not better, we can take care of it, but it's not a big deal. Just 15 years ago, I would have had to say, there's a chance this is meningitis. There's a chance that this is bacterial sepsis. You need to go to the emergency room now. We need to draw blood. We need to check your urine. We need to do a spinal tap. It's extraordinary to imagine that because of those 2 vaccines, families don't need to worry about fever the way they once did.
Before vaccines, many children died from diseases that vaccines now prevent, such as whooping cough, measles, and polio. Those same germs exist today, but vaccines now protect babies, so we do not see these diseases as often. In fact, all common childhood diseases have been dramatically reduced by immunization. This chart shows the dramatic impact that pediatric immunization has had on the number of reported cases of some of the most common childhood diseases. Diseases like measles, diphtheria, mumps, and pertussis.
I grew up in the 50s and 60s and got measles and mumps and chickenpox and German measles. So for me, again, it was very easy to vaccinate my children. But, young parents today not only don't see these diseases because vaccines have been so effective, they didn't even grow up with these diseases. So for them, vaccination becomes a matter of faith.
We as parents, basically, we have to get our children ready for their lives and their future, for them to be happy, to be healthy, to contribute to society. Vaccines are part of that.
To help parents and providers keep track of the immunizations that help prevent harmful diseases, the Centers for Disease Control and Prevention publishes a recommended schedule available online or by request. The Early Childhood Immunization Schedule specifies which vaccines are required and exactly when they should occur during a child's development from birth to age 6. You can find the immunization schedule online at www.cdc.gov/vaccines.
You can click on the link for schedules and access the schedules at that site. The schedules will give you the recommended age for every dose of the routinely recommended vaccines. Be sure to, when you download the schedule, download the footnotes, because there are many important points that you just can't display on the schedule, and keep it simple. So they're in the footnotes. So it's very important that you have the footnotes as well.
The first shot a baby receives occurs just after birth. This is for hepatitis B, a viral infection that can cause jaundice or even worse, liver cancer later in life. Worldwide, hepatitis B causes 80% of all liver cancer. Some parents are concerned about their children receiving a shot so soon after birth, but there is a good reason the hepatitis B vaccine is administered so early.
Hepatitis B virus is transmitted. It's a blood-borne disease. It can be sexually transmitted, but it can also be passed from a pregnant mom to her fetus.
If you catch hepatitis B at or around birth, you have a 90% chance of going on to develop chronic or long-term hepatitis B, which is to say cirrhosis or liver cancer.
We know that the hepatitis B vaccine works to prevent perinatal infection when given at birth, after the baby's born. That birth dose is critical for preventing it.
The second round of immunizations occurs in the pediatrician's office at 2 months of age. They include a second dose of hepatitis B vaccine, a shot to protect against polio, and a shot to protect against Haemophilus influenza, or Hib, a dangerous form of meningitis.
There are cases where I've taken care of kids who have ended up deaf and mentally retarded because of Haemophilus influenza, which it's a shot. It's a shot that could have prevented the deafness, the mental retardation.
At 2 months of age, infants also receive a combination shot, often called DTaP, that protects against diphtheria, a bacterial infection, tetanus, a type of paralysis you can get from a wound infection, and pertussis, which is sometimes known as whooping cough.
For younger children, pertussis is a deadly disease. They literally cannot breathe. They turn blue, and despite all that we do with medications, with ventilators, etc., we very often lose them. I lost one of those children when I was a resident. The pertussis that baby got was brought home from his father.
When Ellie first started coughing, I knew that it wasn't just a normal cough.
Rodney Throgmorton lost his daughter Haley to whooping cough in 2003 when she was just 6 weeks old. Haley contracted pertussis from her dad, who had contracted it from Haley's grandmother.
Haley passed away when she was right at a month and a half old, and she wouldn't have received her first round of DTaP until she was 2 months old.
To protect Haley, Rodney and the other adults and adolescents in his family needed a pertussis booster. A pertussis booster that was developed too late to save Haley.
There were not any pertussis boosters for adults back then. And So I would have been 4 years old when I got my last shot. I didn't realize it as an adult, but my immunity had waned by the time I was 12 for sure.
Since the time of Haley's death, a pertussis booster for adolescents and adults has been developed.
We call it Tdap because it's also combined with the tetanus and diphtheria components.
In January of 2011, the CDC expanded its Tdap recommendations. Adolescents 11 to 18 years of age, preferably at age 11 to 12 years, and adults 19 through 64 years of age should receive a single dose of Tdap. For adults 65 and older who have close contact with an infant and have not previously received Tdap, 1 dose should be received. Tdap should also be given to 7 to 10-year-olds who are not fully immunized against pertussis. Of course, once an infant is 2 months old, the best protection against pertussis is the DTaP shot, a shot Rodney Throgmorton wishes his daughter had been old enough to receive.
I would tell other fathers, it's your job to protect your children, and you don't like to watch a doctor stick a needle in your child, but you sure don't want to watch a doctor put your child on a respirator.
Staying on course with the CDC recommended immunization schedule can ensure a healthy childhood.
I think this schedule is very appropriate. And it's, of course, it's prepared by the Royal Smart people. It's not prepared by trench doctors like me. It's based on years of research and efforts to make sure that it's really the best thing to do for the children.
When you make up a schedule, not only do you increase the period of time during which you're susceptible to vaccine-preventable diseases, but it's confusing, and sometimes kids miss doses.
If a vaccine dose is missed, or if parents get a late start on vaccination, the CDC does have a catch-up immunization scheduler for children age 6 and under.
So when it comes to a series of vaccine doses with one particular vaccine, if someone happens to miss a dose in that series, if the interval between doses is extended, it is not necessary to restart a series. You just pick up where you left off and continue with the series.
Despite their best efforts, some parents and providers have a tough time keeping track of shot schedules and records.
Frankly, the current immunization schedule is complicated. I mean, we now are up to giving vaccines to prevent 14 different diseases in the first few years of life.
That's where Florida Shots, our state's online immunization registry, comes in. Florida Shots helps parents, healthcare providers, and schools safeguard immunization records in a free, statewide, centralized online registry.
What a vaccine registry allows families to do and pediatric practitioners to do is to know which children have had their vaccines when.
Florida Shots also provides simplified shot record verification when it's time for kids to go to school. Starting in pre-kindergarten, all children who attend public and private schools in Florida must meet the immunization requirements mandated by the Department of Health. These requirements help protect children from potentially harmful vaccine-preventable diseases.
Children who are starting kindergarten are required to have 2 MMRs, 2 varicellas, 3 hepatitis B vaccines, and 4 polios and 5 DTaPs.
Florida Shots helps ensure that shot records are up to date and reduces registration hassles for schools and parents.
Students who aren't in compliance with their immunizations are not allowed to attend school. My Florida Shots gives the school staff the ability to pull them up, thus limiting parents running around trying to get the immunization status, and then the schools can enroll the child.
While Florida Shots can help parents, schools, and providers keep track of shots, many families need help paying for vaccinations. The Florida Vaccines for Children program helps ease the financial burden for parents.
Anybody under 18 can qualify for vaccines for children if they have no other source, primarily through private health insurance, to get that. They can get those vaccines for free without any cost to the parent through the Department of Health or through their healthcare provider. Their pediatrician, their family practitioner, their nurse practitioner will have vaccines with the Vaccines for Children program, and they can get that at no cost to them.
Together, Florida Shots and Florida Vaccines for Children ensure that babies and young children receive their shots when they need them most.
Pediatrics prevention's the name of the game. We know that whether you're talking pool safety or booster seats or immunizations, it's far better to prevent a disease or a disaster than to try to repair it.
In a war against nature, my body will try to fight off these enemies so that I don't die.
At first, it's disconcerting to hear Abby Wold, a young woman filled with joy and life, read a poem about staring down death.
Are they right? My last rites? Will tonight be my forever good night?
Abby's poem is about her fight with a bacterial infection that strikes between 1,000 and 2,600 Americans every year, 1/3 of them teens and young adults.
By the time we got to the emergency room, I couldn't walk anymore. They had to push me in a wheelchair. And the last thing I remember for a while is telling the nurse, I think I have meningitis.
Abby's battle with meningococcal meningitis began in the Tampa area in 2003 when she was 22. At first, she thought she had a fever. Within hours, she was fighting for her life.
From there, I don't really remember much. A lot of things happened between there and when I woke up. I had multiple organ failure, obviously. I ended up on a ventilator and in a coma.
Abby eventually awoke from her coma, but she ended up having both legs amputated below the knees. Today, she continues to face medical challenges.
Surgery, rehab, surgery, rehab, surgery, rehab. You know, it's just become a pattern.
A number of serious diseases, like the one that almost killed Abby, spread easily because of the close personal contact that many adolescents and young adults share. That is why the Centers for Disease Control and Prevention recommends preteens and teens receive these 3 vaccines: the tetanus diphtheria acellular pertussis vaccine, or Tdap, the meningococcal vaccine, and the human papillomavirus vaccine. Despite the availability of these potentially life-saving vaccines, immunization rates for adolescents are significantly lower than immunization rates for young children.
I think we tend to think of immunizations as a kid's thing to do, and so we're very good about immunizing kids, but we get less good about immunizing people as they get older. And so our immunization rates for adolescents aren't nearly as good as they should be for vaccines like Tdap, tetanus, diphtheria, acellular pertussis, or the HPV or human papillomavirus vaccine, or the meningococcal vaccine.
The consequences of these lower preteen immunization rates are being felt across the nation.
State health officials say more than 6,400 cases of whooping cough have been reported this year.
Matthew's doctors suspected it could be whooping cough, also known as pertussis.
We have seen outbreaks of pertussis in California and South Carolina, statewide outbreaks. We've also seen regional outbreaks in Michigan, New York, North Carolina, Ohio, and Georgia. So we've seen them in many states in the United States.
Pertussis, or whooping cough as it's commonly known, begins like a bad cold, followed by an uncontrollable cough. It's a potentially deadly disease, particularly for infants. Whooping cough was thought to be under control, but recently a number of states have experienced waves of pertussis cases. That's largely due to low vaccination rates among adolescents. According to the CDC's 2009 Teen National Immunization Survey, just 47% of Florida's 13 to 17-year-olds had received a Tdap pertussis booster shot, a booster shot that teens need as immunity to pertussis wanes in the teen years.
And what's happened with pertussis is we've found that protection provided by the infant vaccine wanes over time. The antibodies that you develop when you receive a vaccine, you lose those antibodies over time, and so your protection goes away. And so that's why we are now seeing adolescents with the disease pertussis, and we know that those adolescents can spread pertussis to their classmates, to their housemates, to younger children, in fact. So that's another thing that we're seeing with pertussis as well.
Although the Tdap vaccine is recommended for all adolescents, including in California, the immunization rates among them is about 40%. It's also recommended for adults who live in the home of someone who was just born, and the immunization rates are about 6%.
In 2010, the CDC says there were 21,000 cases of whooping cough and 26 deaths. California experienced its worst epidemic in 65 years.
Look at the pertussis outbreak or whooping cough outbreak in California. 10 children have died. All those children are less than 3 months of age. All of them were too young to be effectively vaccinated. Where did they catch that bacteria from? Most likely from someone in the home. Most likely from parents or an older sib.
All students entering, attending, or transferring to the 7th grade in Florida are required to have 1 dose of the tetanus diphtheria pertussis Tdap vaccine. And in 2011, the CDC expanded its Tdap recommendations. Adolescents 11 to 18 years of age, preferably at age 11 through 12, should receive a Tdap dose. Children 7 through 10 who are not fully immunized against pertussis should receive a Tdap vaccination. A Tdap dose can also be given regardless of the timing of an adolescent's last tetanus and diphtheria booster. All adults need a one-time dose of the Tdap vaccine. Adults who just received their TD booster and anticipate being around infants and young children do not need to wait for a Tdap dose. And adults 65 and older should get a dose if they anticipate being around infants. For other adults aged 65 years and older, a single dose of Tdap vaccine may be given instead of TD vaccine in persons who have not previously received Tdap.
Pertussis is still a disease that's uncontrolled in the United States. It can be with vaccination, but we're not there yet. We need to achieve those higher than 90-95% levels of coverage in order to prevent transmission.
While the medical community is working to raise pertussis vaccination rates, another adolescent vaccine has posed an even bigger challenge for healthcare providers. It's a vaccine that protects against human papillomavirus, the most common sexually transmitted virus in the U.S.
It's a really common infection. Approximately 80% of women at some point in their life will have been infected with human papillomavirus.
Dr. Anna Giuliano is a researcher at the Moffitt Cancer Center in Tampa. She and her colleagues conducted a study that found human papillomavirus, or HPV, is not only common in women, it's also common in men.
In our studies, and we're studying men in 3 countries, in Brazil, Mexico, and the United States, we see that around 50 to 60% of men will have HPV at the external genital epithelium.
Most women and men are able to effectively clear the HPV infection through their own immune response. But for others, HPV can create lifelong health issues.
The most common health problem for both men and women is genital warts.
But HPV can also cause several cancers in men and women, most notably cervical cancer, which the CDC says about 10,000 women are diagnosed with every year. About 3,000 women a year die from the disease. The HPV vaccine is available as a 3-dose series for males and females to protect against the types of HPV that most commonly cause health problems.
CDC recommends HPV vaccine for females 11 and 12 years of age, as well as vaccine doses as a catch-up for females 13 through 26 years of age that didn't previously receive the doses of vaccine.
The HPV vaccine may also be administered in a 3-dose series to males aged 9 through 26 to reduce their likelihood of genital warts.
And this vaccine is highly effective. We're talking close to 100% effective in preventing the infections that the vaccine is directed against.
Despite the protection the HPV vaccine provides, coverage levels among adolescents remain low. According to the CDC's 2009 National Immunization Survey, only 39% of girls in Florida received at least one dose of the 3-dose HPV vaccine series. Nationally, that rate was only 44%.
We want to vaccinate prior to sexual exposure. But that really then becomes so dependent on the physician initiating the conversation.
Parents and patients are not always going to know exactly at what age sex is going to begin. So it's very, very important that you give a dose of vaccine before that.
In terms of cancer, this is the best news we've had in a very, very long time. We need to capitalize on it.
It's incomprehensible to me that we have a way to eradicate this disease and we're not going to do it.
Dr. Guy Ben-Ruby, a gynecological oncologist at Shands Jacksonville Medical Center, has seen women suffer and die because of cervical cancer. He says it's frustrating to see so many adolescents not receiving a vaccine that's 100% effective in preventing the HPV infections that cause cervical cancer.
The vaccine was released in the summer of 2006. 4 years later, if we look at all the potential recipients of this vaccine, in other words, all the kids from 11 to 26 that could be vaccinated, only 12% have been vaccinated. So this is a very terribly missed opportunity. There are literally millions of kids that got infected with HPV between 2006 and now that should not have been infected.
Abby Wold knows thousands of Florida teens are also missing an opportunity to protect themselves from meningococcal meningitis. Today, as a Florida team leader for the national nonprofit group Meningitis Angels, she fights to focus attention on the meningococcal bacteria, a bacteria that as much as 15% of the population carries in the nose or throat.
You could be carrying it now and, sneeze on someone. You wouldn't have no idea you're carrying it and they could die by tomorrow. That's the scary thing about it, and people don't realize that.
The Centers for Disease Control and Prevention recommends all 11 to 12-year-olds receive the meningococcal conjugate vaccine. Because immunity begins to drop off, teens should also receive a booster dose at age 16. If vaccinated at age 13 to 15, a booster is recommended at ages 16 through 18. Adolescents who receive their first dose of meningococcal vaccine at or after the age of 16 do not need a booster dose. Following these vaccine guidelines can help prevent the spread of meningitis in places like dorms and summer camps. But the CDC says that as of 2010, only 1 in 2 Florida teenagers had received a meningitis shot.
Well, we teach vaccinate at every opportunity. That is because a lot of our teenagers do not come in for regular checkups.
Vaccine registries like Florida Shots can also help increase adolescent immunization rates by keeping track of shot records and reminding providers and parents what shots are due. The Florida Vaccines for Children program helps remove another barrier to adolescent immunization, the cost of the vaccines. Any Florida licensed healthcare provider can enroll in Florida Shots and the Florida Vaccines for Children program for free. Easy online enrollment applications are available at www.flshots.com for Florida Shots and www.immunizeflorida.com/VFC for the Florida Vaccines for Children program. Abby Wold says it is critical that providers take advantage of Florida Shots and Florida Vaccines for Children.
Vaccinations save lives. I can prove exactly what bacteria and what serotype did this to me. And it could have been stopped by a vaccine.